that has been performed by all the group of PITEMA, and we include patients for 10 clinical hospital of here in Spain. We focus on patients with acute myeloid leukemia in older patients and unfit patients to receive intensive chemotherapy. The aim of the trial was to find a dose of Quizartinib associated to Azacitidine and Venetoclax or Cytarabine, and to see the effectivity of the combination of the triplet. We find in the first phase of the trial that Quizartinib with 40 milligrams was acceptable for the patients with low dose Cytarabine and Venetoclax, and we find a dose of 60 milligrams of Quizartinib acceptable to Venetoclax and Azacitidine. And the phase 2 of the trial, what that was, see the effectivity of the trial showed that both arms, low dose Cytarabine and Azacitidine, were similar in results. We see something that we think that is very important in subsequent trials. First of all, we see that the effectivity of the trial was mainly in patients with no previous myelodysplastic syndrome or not treated previously with Azacitidine. This trial in the phase 2 was similar to the trial of low-dose Cytarabine, Azacitidine, and Venetoclax, and we include all type of patients with previously myelodysplastic or previous treatment with Azacitidine. And we see that the complete response rate was more than 50% of the patients. We see that in the patients with no previous myelodysplastic syndrome or with FLT3-ITD mutation, the rates of complete remission and the overall survival was very, very interesting and very amazing. We can say that there are 19 patients. Some of them has achieved the incredible age of 90 years old. They are in complete remission with minimal residual disease negative. And it's curious because even in the trial with Azacitidine Venetoclax, there weren't differences between patients with previously myelodysplastic or de novo acute myeloid leukemia. There are some caveats in the trial. The first of all, the number of patients. We expect that we are going to perform a phase 3 trial in this type of patients with no previously myelodysplastic syndrome. And the second, we don't have a clear comparison with Azacitidine Venetoclax in order to see if these are a very new or more potent combination with the triplet. I can say that seeing the results of the QUI trial, perhaps the combination of an inhibitor of FLT3 can be successful in patients with a phenotype of de novo acute myeloid leukemia. Perhaps in myelodysplastic syndromes, this type of triplet chemotherapy don't work.